know, I guess I'll just like move it around to like do it here.
The
Like that-
control thing.
Yeah, the control thing that like, the computerized, that does the replacement and knee replacement.
We don't do computerized knee replacements, we do surgeon hip and knee replacements. We do have a system called a navigation system.
Oh, yeah, that's what
We
I
do that
meant,
with knees.
Mhm.
In one of our companies, we do it here.
Okay.
So the 3 suites here, theaters we call them, because
Okay.
we look like movie stars. So 1, 2, and 3 are all navigation suites.
Okay.
Before we scrub in, let's complete the pre-op for this patient.
But this, is this our
Our patient is a 62-year-old female with very healthy bones. She is 5 foot 8 inches tall and weighs 190 pounds. Based on this patient's expertise, which hip do you think needs surgery?
This one?
You know, drumsticks and get like a fried chicken. But when it's gone, then then you have the bread. So you don't see cartilage on X-rays. All you see is bone.
Okay.
So this space here
Yeah.
is cartilage. On this one, there's no space left. So
Okay.
it's this one there.
Great job! As you can see, most of the cartilage or cushion between the bones is gone, especially in the upper portion of the hip joint. Now, let's template or measure the hip to determine what size prosthetic to use. I'll hold the templates up to this x-ray and you find the correct fit. The stem, a metal piece that will fit into the hip, should be no wider than the canal in the middle of the bone. Which size stem do you think works best for this patient?
This one? No.
It's kind of like Goldilocks. One's too big, one's too small.
This one?
Well, do the
Great work!
no more hints.
Determine the size of the metal cup. Again, using a template. Which size do you think will work for this patient? Yes, that is correct. The OR team has prepped and draped our patient. We are now ready to operate. First, locate the top of the greater trochanter bone and use the sterile marker to mark the incision area.
It's a bump you can feel right here. Yeah, put a line there. Go along line.
Oh, it's like undone?
No. Yeah, so is that big nerve? So as big as your thumb.
No, try again.
B? It's a feeling thing. Oh, yeah, because it's a nerve.
Good job. I already cut the 6 muscles that connect to the top of the finger and then folded the first set of muscles back as one side. Now, we are able to see the flexible sac or capsule around the joint. Cut open the capsule and put in sutures to hold it back.
The holes will be small, so it won't that big.
Yeah. I'll finish with a size 51 millimeter reamer, preparing the acetabulum for the prosthetic cup. Note that we are staying one size smaller than the final 52 millimeter prosthetic cup. This prosthetic cup is mounted on an insertion device, which also serves as a guide to achieve
So you go up in sizes as you go.
Align the
Start
insertion
small,
device with
go
the
up,
guides.
see it until it fits.
The part of the metal cup that is in contact with the bone as well allows the bone to attach or grow to the cup. This is known as bone in growth and is important to the long-term stability of the strength. The lines
Just the other side now.
are a bit more covered to the top back part of the cup. Why would this be the case?
If Daryl's
Not quite.
power tools clean.
Okay.
Now to tap the rasp into the bone.
You want a 12 rasp here.
Okay, that's just the starter. You want a 12? That's
Yeah.
This thing? Okay.
Yeah.
huge. That's our biggest one. By the way, I started. This is
Good. I'm going to rasp the bone again using a size 13. Take the handle off the final rasp.
Click on it.
Place the trial ball onto the end of the rasp. I'll pop the ball into the plastic cup.
And I'll get the neck.
Now we're ready to test the range of motion, making
try to make sure it fits
Check to
together.
see if the kneecaps and the heels
Put it in there and make sure it goes without dislocating.
That's so cool. So we have like this, I went to like the body wall show and it comes to science. It's like, and then it's sort of like a real ball, like actually like a ball.
Yeah.
And then showed like a replacement one. So like, why don't you guys just like put it in the ball? Why is it like happening?
I don't understand your question.
Like, you know how we right now have like a kind of like a perfect size ball right now
Yeah.
at the hip? Why don't you guys just make it like that instead of putting this one?
You have to adjust for size, so you need some wheel to change. But this is a ball and that is a perfect ball as well. But you need to be able to adjust this size because people have different size acetabulum.
Yeah.
You also have to be able to adjust this because people have different size femurs.
Yeah.
So this is. Go ahead.
Just both. The one goes forward and the other goes backwards. Careful with my face.
You can change the size.
Yeah.
That goes in the bone. It's like see if you can take it apart. On this.
On this?
So let's see.
Yeah, so look at this, girls.
Can I split over here?
So you can see how this is a more normal one, and that's all
Yeah.
right now, right? So you have to make this round.
Difference. So why would that happen on that leg but not the other one?
Most of the time people have genetics where the ball and socket don't quite fit properly,
Yeah.
and you end up with a round ball and an egg-shaped socket. So that's more common in girls, so girls can have one or more and the socket's too shallow.
Mm-hmm.
And boys, when they're growing, sometimes they can have an insult to the blood supply to their head. Instead of the head being round, it comes mushroom shaped. So they don't quite fit properly when they wear out.
Yeah.
Room is an orthopedic OR, and so we use a number of tools actually that look like what you would find out in your garage. So it's orthopedic instruments, they're heavy instruments, we hammers, saws, drills, everything that you could possibly think of. Because we cut bones and we hammer things in place.
Yeah.
Have you ever performed a new procedure?
Like you guys like registered nurse, like assistant.
In the OR?
Yeah.
Oh yes, all the time. So when I started in the OR, I worked in Wetaskiwin, and I wasn't an OR nurse. And so at that point in time, the principle was see one, do one, and teach one. So I started out learning how to sterile technique, and the very first surgery I scrubbed on was a cataract surgery. So where they take out the milky white lens and they it's pretty daunting for patients, especially if they haven't been in the hospital. You take away everything that's them and just leave them with a gown and a blanket. So you really have to gain their trust pretty quickly. So then we've got 3 ORs that we use. So you were in one here before.
Yeah.
So they can, the vital signs can be very labile. They can be very sick after the anesthetic. So watch them for at least a half an hour, and then if everything's great, they look good, then they go upstairs. And then the freezing comes out eventually, or they wake up and they're a lot more alert, and then they're on the road to recovery.